everyone, and thank you so much for joining the Needy Meds special topic webinar, Financial Assistance for Patients with Rare Diseases, presented by our partner, the PAN Foundation. My name is Carla. I'm the Director of User Engagement here at Needy Meds, and before we get started, I'm going to offer a few tips. So hopefully you can make the most out of today's presentation. First of all, if you do have questions, you can feel free to type them in at any time into that question section. For some of you, it may actually be the chat section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have the time to answer your question, we'll follow up with you by email, but we will also provide the contact information for Needy Meds and, importantly, the PAN Foundation at the end. Also, I'm happy to let you know that today's presentation is being recorded and will be available on the Needy Meds YouTube channel, which we encourage you to subscribe to. And you can find materials we thought you'd be interested in that handout section of your GoToWebinar control panel. So with that, let's get started with what is Needy Meds. For those of you not familiar yet with us, we're a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Richard Sagel, and his friend, Libby Overly, who is a medical social worker. What you're looking at is our mission statement, but simply put, Needy Meds connects people to healthcare saving resources. And we do this free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And as I said, don't worry, we will keep the contact information for Needy Meds up at the end of the presentation as well. I also, for those of you that join our webinars, know that I do like to put up a screenshot of the Needy Meds homepage because really our website is the face of our organization. And it gives me a chance to point out a few resources, such as the Healthcare Savings tab, which is your destination if you are in fact looking for healthcare savings resources. To stay up to date on what's new at Needy Meds, check out the Education tab. This is where you can sign up to receive webinar announcements, our monthly e-newsletter, and order brochures, for example. So just a few moments ago, I mentioned that this webinar is being recorded and will be available on our YouTube channel. And you can find a link to that on the top right with the rest of the social media icons. As I said, I hope you subscribe. That way you'll be notified when new presentations, webinars, and videos are added, so you'll never miss out. You can also find other upcoming webinars on the calendar of events on the bottom right-hand side. So as you saw a couple of slides ago, a big part of our mission is education. And we define that, of course, by educating people about Needy Meds and the resources we offer, but also we define and fulfill that education part of our mission by sharing with users other resources that will help people on their healthcare journey, such as the PAN Foundation. So we are so pleased to have our guest Joan with us today from the PAN Foundation. But first, before I hand over the mic and screen to Joan for the presentation and why you're all here, I just want to tell you a little bit about the PAN Foundation. Very simply, PAN helps underinsured people with life-threatening, chronic, and rare diseases get the medications and treatment they need by paying for their out-of-pocket costs and advocating for improved access and affordability. So now, let me tell you a little bit about our guest, my friend and colleague, Joan Zhang. Joan's title is the Manager of Medical Affairs at the PAN Foundation. She reviews the clinical parameters of PAN's assistance programs and conducts outreach to pharmacies and related professional groups. She's a licensed pharmacist with a Doctor of Pharmacy degree from Shenandoah, I always get that wrong, Shenandoah University, Bernard J. Dunn School of Pharmacy. So we're very lucky because Joan is going to speak with us today about specifically how the PAN Foundation can help patients with rare diseases get financial support. And we're so pleased to have her offering this specialized webinar because from the number of people that signed up to join us, we know it's something NeedyMeds users are very interested in. So without further ado, I'm going to go ahead and pass the mic and the screen to Joan. Now, as I do that and she grabs the screen, I will remind everybody that if you do have questions, don't hesitate to type them into that questions section of your GoToWebinar control panel. As I said, that actually may be the chat section for some of you, and we will reserve answering questions until the end. Of course, as I said, if we don't get the chance to answer your specific question, we will follow up with you by email. So, Joan, let's see, I went ahead and passed that screen to you, Joan, so there should be, there we go. It switched back to my screen. Perfect. Now I am looking at your screen, and thank you to our audience members. They can see your screen clearly as well. So with that, I'm going to go ahead and pass the mic to Joan. Enjoy today's presentation, everyone, and thanks for joining us. Thanks, Joan.
Thank you, Carla, for that warm introduction. Hi, everyone. I am so glad that you're able to join us today for this webinar on finding financial assistance for patients with rare diseases at the Patient Access Network Foundation, also known as the PAN Foundation. My name is Joan Zhang, and I am the Manager of Medical Affairs at PAN. Today, I would like to talk to you about our disease funds and our outreach to the rare disease community. At the PAN Foundation, we're committed to helping people living with rare diseases find financial support. I'm excited to connect with the rare disease community today and share all of our resources with you. Today, I will introduce who we are, the impact and the assistance that we have for patients with rare diseases, and how you can apply and receive financial support from the PAN Foundation. Please send us your questions during the webinar in the chat box. Okay, let's go ahead and get started on why we do what we do. There are approximately 7,000 to 10,000 known rare diseases, and many are life-threatening, hard to diagnose, and to treat. According to an NIH study in 2021, rare diseases collectively affected 24 to 30 million people in the United States alone. The annual direct medical cost is estimated at $400 billion, similar to those with cancer, Alzheimer's, and heart disease. The estimated treatment cost per person ranges from $8,800 to over $140,000 per year. In fact, individuals with rare diseases face medical costs 3 to 5 times greater than those who do not have rare disease. For these patients, access to medically necessary treatments is critical for successful disease outcomes. However, this access can be blocked by the high out-of-pocket cost, which can add up quickly, increasing the financial burden, and so finding financial help to cover the out-of-pocket cost is vital for survivorship. At the PAN Foundation, we believe that out-of-pocket costs should not prevent anyone from obtaining medically necessary treatment. So today I will share how PAN can help remove some of the financial barriers and alleviate high out-of-pocket costs for those with rare disease. Let's get started with who we are. PAN is a national patient assistance organization that helps underinsured people pay for their out-of-pocket treatment costs while advocating for more affordable care. Since its founding in 2004, we have provided over 1 million underinsured patients with $4 billion in financial assistance. We currently have 70 disease funds, of which 24 are for rare diseases. and we hope to continue expanding to reach and assist more people. Currently, we have 3 types of assistance programs to help patients with their out-of-pocket costs. The first program is our Medication Assistance Program, which assists patients with deductibles, copays, and coinsurance for their medications. The second program is our Premium Assistance Programs, which assist patients in paying monthly primary or secondary health insurance premiums. The third program is our Transportation Assistance Program. We broadened this program last year to include all disease funds. The program covers travel expenses sustained from the patient's treatment visits. Once approved, the Transportation Assistance Program covers rideshare, car rentals, parking, and airfare, as well as approved lodging such as hotels, Airbnb, and temporary housing. I want to note that in order to qualify for our transportation program, the patient must be enrolled in one of our medication assistance programs. Finally, the transportation program is not limited to rare diseases only, but it covers all disease states that PAN supports, including chronic diseases and oncology. Also, all of our programs are allocated in the form of financial grants to help the patients pay for their prescribed medications, transportation, and insurance premiums. As I mentioned earlier, 24 of our disease funds help cover rare diseases. We have recently added Duchenne muscular dystrophy and Pompe disease to our list of disease funds. Overall, we provide assistance across 70 disease funds that range from chronic to rare to oncology diseases. To see a complete listing and current statuses of all of our programs, please visit our website at panfoundation.org. A common question we receive is what medications we cover. Every disease fund has a list of covered medications considered for reimbursement. PAN is also diagnosis-based, and so in addition to our formulary, we also have a complete list of covered diagnosis codes under each disease fund. For every disease fund, we cover FDA-approved medications and listed in official compendia or evidence-based guidelines indicated for that specific disease state. These include all prescription medications in the formulary, such as brand and generic medications, bioequivalent or biosimilar medications, specialty drugs, and radiopharmaceuticals. Now that you know what PAN covers, let's briefly touch upon what is not covered since we receive requests for payments for these products and services. First, PAN is a payer of last resort, which means we pay the patient's responsibility or out-of-pocket cost after the insurance makes a payment. Therefore, we do not reimburse any medication which is covered at 100% by the health insurance or medication that the insurance did not make a payment on. As discussed earlier, the medication must be on the disease fund formulary to be considered for reimbursement. However, there is an exception to this rule. If a medication is indicated or guideline recommended for your specific disease state, but is not listed on our formulary, you can submit a request on our website or call us to have the drug added to our formulary. We will review your request and provide a determination. And finally, we do not cover services such as doctor's visits, lab work, genetic testing, emergency room or hospital visits, and diagnostic testing. There are three fund statuses at PAN: open, closed, and open and waitlist only. When the fund status is open, it means that funding is available currently and the disease fund is open for all to apply for assistance. When the disease fund is closed, it means that funding is currently not available for that disease fund, but if you are interested in applying for assistance when it opens, you can add yourself to the wait list. You will receive notifications when the fund opens in waitlist status to apply. Which brings us to our final status, open in waitlist, meaning funding is currently available for that disease fund, but it is only open to those on the waitlist. Therefore, during this time, only individuals on the waitlist can apply. It is crucial to understand the different statuses at PAN to optimize your search for financial assistance. The next few slides will focus on applying for assistance with PAN. There are 4 easy steps to keep in mind when applying. Step 1 is to check if the disease fund is open. There are several ways you can do this. You can go on the PAN website at panfoundation.org under Find a Disease Fund, or type the name of the disease on the home page. Another way is by visiting our portal to verify the fund status under the Disease Fund and Medications tab. And lastly, you can call PAN to verify the status of all of our disease funds. Step 2 is to verify if you meet the eligibility criteria for the disease fund you are applying to. The following are our eligibility guidelines for all of our disease funds. 1, you must be getting treatment for the specific disease fund you are applying. This means if you are applying for the assistance for hemophilia, you must have that diagnosis or one of the subtypes underneath the hemophilia disease fund. 2, the medication or product must be listed on the specific disease fund formulary and must be covered by your health insurance. 3, the patient's income must fall 400 or 500% at or below the federal poverty level specified by the Disease Assistance Program. It's important to note that the insurance and income guidelines vary for each disease program, so please be sure to verify this and all of this program guidelines on the specific disease fund page. 4, the patient must live and receive treatment in the United States or U.S. territories, although U.S. citizenship is not a requirement. Certain programs, such as the Transportation Fund, have additional requirements, so please check the PAN website for more details. Step 3 is to gather all of the required information. If you meet the criteria listed on the previous slide, you will need to gather the following information before starting the application process. You will need the demographic information, such as the name, address, phone number, and email address. You will also need the diagnosis, medication name, as well as your health insurance information. Also, your income, number of people in your household, and lastly, the physician and facility contact information. This slide is an example of the Gaucher Disease Fund page on our website. When you click into the Assistance Program page, you can verify the assistance amount, eligibility criteria, and start the application process. But before you do that, make sure you verify the medications covered for reimbursement. You can also check the disease fund subtypes and find related advocacy and alliance partners for the disease state right on this page. Now you are ready to submit your application. There are 3 main ways to do this. As previously mentioned, you can apply directly on our website, or you can log on to one of our 3 self-service portals listed here. As you can see, each portal is designed with the end user group in mind. The provider portal serves our healthcare providers, whereas our pharmacy portal is intended to serve our pharmacy personnel. And most importantly, our patient portal is designed to serve our patients and caregiver population. Lastly, you can give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Time at 866-316-7263. On average, it takes less than 10 minutes to complete an application, and our enrollment decision is instant. We'll provide you with the enrollment details and processing information right away. We can also mail or fax or email the patient and then follow up with a mail or fax to the enrolling physician upon request. Once you're enrolled, you can begin submitting your claims to PAN for reimbursement immediately. We want the reimbursement process to be quick and straightforward, so we provide several ways to submit your claims. If you receive your medication from a pharmacy, the pharmacy can bill PAN on your behalf. If you receive your medication from the doctor's office can also bill PAN. If you prefer to bill PAN directly, you can submit the prescription label or the explanation of benefits for the services or medications you received at the pharmacy with a complete direct member reimbursement form to PAN. Or you can submit an explanation of benefits for services or medications received at the doctor's office with a complete direct member reimbursement form. Additional information on filing claims and the direct member reimbursement form can be found on our website at panfoundation.org under Get Help. We'll also be sure to communicate with you every step of the way until you receive your payment. There are a few things to keep in mind throughout the life of your grants. Each PAN grant eligibility period is for 12 months. However, for first-time enrollees in any disease fund, we provide a 90-day look-back period to allow reimbursement for claims that you may have acquired prior to contacting us. In addition, we also have a grant use policy, which requires a claim submission and payment every 120 days to keep the grant active throughout the eligibility period. Our grants provide 100% assistance support for most of our patients. We look at the historical data and industry trends to determine how much a patient is going to need for a specific disease fund, and then we allocate a certain dollar amount to that fund. If the patient needs additional assistance because their out-of-pocket cost is higher than the average, we offer additional assistance called second grants to cover the remainder of the enrollment period if the fund is open. We also review our assistance amounts annually to adjust and ensure patients receive adequate financial support throughout the year. And finally, don't forget to renew your grant after your 1-year eligibility period ends. You may start renewing it up to 30 days before the current grant ends. One way to stay connected is through our portals. As we discussed earlier, we have 3 portals, one for the patient, the provider, and the pharmacy. On all 3 portals, you may utilize the following features. You can apply for assistance, see fund statuses, manage your accounts, review your eligibility period and grant balance, sign up for a second grant if you are out of funding, renew your grant starting from 1 month before the end of the eligibility period, and review correspondence letters regarding your account. In addition to these features, you may also communicate with our portal support team via secure messaging and view process claims and run reports, as well as upload and submit claims directly on the portals. Finally, announcements and updates are displayed on the pharmacy and provider portal login pages. PAN's portals will allow you to do all of this without having to pick up the phone. We want to encourage you to stay connected with us once you enroll with PAN. We understand that you have a busy schedule, and because of that, we've made our processes quick and simple for you to stay connected, and we provide many resources to help you along the way. As we previously talked about, the PAN Foundation has a transportation add-on program for patients enrolled in a copay disease fund. The transportation program offers $500 for travel to and from their doctors or pharmacy visits. It covers all major forms of transportation and lodging in the form of a prepaid debit card. We understand that managing an illness is complex, and our patients who apply for assistance with PAN may need additional support beyond financial aid. They may also have questions about their disease, treatment, side effects, and medication adherence. And they may also benefit from connecting with a compassionate community that can help rare disease patients deal with the physical and emotional complexities of their disease. This is why we have formed alliances with leading patient advocacy groups such as the Amyloidosis Foundation to provide patients with the holistic support they need. PAN also created a free web-based app called FundFinder. This first-of-its-kind web app helps all audiences track the disease fund statuses across 9 charitable copay assistance foundations. You can simply go to fundfinder.org, or you can find the link on our website. Once you sign up, you may follow any disease fund and receive notification alerts via email or text message when that specific fund opens at any of the foundations. FundFinder helps you save time by not having to check multiple websites frequently. Our goal is to help you find the support and resources you need so you can spend less time on the manual work. We know that PAN Foundation is one of many resources to help you with out-of-pocket costs, and we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help. Thank you all so much for joining us today. To learn more about the PAN Foundation and our programs, please visit our website at panfoundation.org, sign up for our portals, or you can call us at 866-316-7263. You may also reach out to me if you have specific questions about a particular situation, and I will be more than happy to help. I look forward to assisting you soon, and again, thank you so much for your time. I'll go ahead and turn it back to Carla, who will lead our question and answer section.
Joan, thank you so much for the thorough and easy to understand presentation. And no doubt our attendees are seeing why we're so proud of our partnership with the PAN Foundation. I've said this before, and I really will stress it, that I think what's crucial is not only does the PAN Foundation provide assistance for the underserved, and certainly for patients with rare diseases, which is this topic we're focusing on today, but the PAN Foundation team goes above and beyond to make the process of applying for that assistance transparent, easy, and there's a lot of assistance, especially through that 800 number. So, as Joan said, please take time to visit that website and reach out to the call center if you have any questions at all. And we do have some questions coming in. We're going to get to those in just a moment. Before we do, I want to remind everybody how to submit questions. And you can do that by typing those into that question section of your GoToWebinar control panel. As I've said before, for some of you, it may be actually the chat section, so just keep that in mind. And as those questions come in, I want to just remind everybody that Needy Meds is here as a source of financial support for your healthcare expenses as well. What you're looking at on the screen are all of the different categories and ways we can help you to save on your medications and other healthcare costs under that healthcare savings tab on needymeds.org. And you can learn more about each of these categories by simply visiting our website and checking them out and joining us for one of our monthly Needy Meds overview webinars titled Help with Healthcare Costs. And if you're looking for help with affording a specific medication or medical expense, don't hesitate to reach out to our call center. And again, I will have that phone number along with the PAN toll-free helpline up at the end of the presentation. In the meantime, and there's Joan's contact information as well as the PAN Foundation 800, or excuse me, toll-free number, which is 866 316 7263, and the website panfoundation.org. Easy enough. So let's get to some of those questions coming in for you, Joan. The first one that actually came in a little bit was, my rare disease is not on your list of disease funds. How can I request that fund?
Thank you, Carla, and thank you everyone for submitting your questions. If you do not see your rare disease listed on our list of disease funds, you can submit a message to us within the disease state contact us form on the website with the disease state that you are interested in. In addition, you can call us or submit your request that way. We consistently review disease states to find additional ways we can assist patients from various disease areas with their high out-of-pocket costs. Although PAN may not support your disease state at this time, other charitable copay foundations may have a disease fund available. We recommend signing up for Fund Finder to determine if your disease is available at another foundation.
I'm so glad that question was asked because it really showcases how responsive the PAN Foundation is to the people that turn to them for help. So if you can't find your diagnosis on their list of disease funds at the moment, you can let them know, as Joan said, and you can also reach out to them, because the great thing is if your disease fund isn't on their list yet, which is, as Joan said, being ever evaluated, they will hopefully be able to connect you to another program. Please sign up for that Fund Finder. It's invaluable. So another question that came in was, and this is actually another great question, what if I don't know the diagnosis code when I call? That's super important.
That is a great question. As long as you know the name of the disease state and the medication you are taking to treat the disease, our patient support representatives can search our system to determine if your condition and medication qualifies for any of our assistance programs. You can also do this yourself to see if the disease is covered by searching your disease name or the disease subtype on the PAN Foundation underneath Find a Disease Fund. Another criteria you can use on our website is the medication itself. By searching the medication, it will generate all of the programs that covers your medication to determine if it matches your disease state. Finally, your healthcare provider can also check your diagnosis codes on our website via the search bar or on the individual assistance pages, and then apply on your behalf. If you still aren't sure, we recommend that you follow up with your healthcare provider to determine the correct disease fund you should enroll at PAN.
so important. And I'm glad you pointed out the way to search for medications on your website. That's super helpful. Joan, we got another question. Actually, this question in different form came in from at least two of our attendees. The question is basically this: if a patient is on the wait list and they get approved for a medical assistance program, does the program backdate for coverage, or does the coverage start when it's approved?
That's a great question. So, if you are applying for this disease fund for the first time at the PAN Foundation, we offer a 90-day look back period. So, the eligibility period will begin 90 days before the date that you are approved. And this is to help cover any of those medication costs that you might have acquired prior to contacting us.
That's fantastic. And I'm glad again, I always say this to our audience members, that if you have a question on your mind, please don't hesitate to ask it, because the chances are somebody else is wondering about the same thing. And this gave Joan an opportunity to highlight that there is a 90-day look back period, which is super helpful. So, another question coming in, and as those of you that do attend Needy Meds webinars regularly, you know I do attempt to keep the question segment of the presentation brief. So we're only going to get to a couple more questions, but don't worry if we didn't get a chance to answer yours. You can reach out to that PAN Foundation, or you will hear from us by email. So another question: what should somebody do if their medication isn't covered?
So if your medication is not covered or you can't find it on our website, you can submit a message to us if you do not see it listed. And in addition, you can also call us at 866-316-7263 and submit your request that way. We have a team who will evaluate and review the drug request. So please allow 7 business days for PAN to follow up on your request.
Thank you. And I love that the PAN Foundation, as I said in the beginning, not only are they easy to apply to, but transparent. They let you know what to expect, how long you have to wait for the process to be complete. Joan, a couple of people have asked some questions about the Fund Finder app, so I'm so glad about Fund Finder. I'm so glad people are interested. And we have somebody asking whether or not there's a Fund Finder app that can be downloaded to their phone.
That's a great question. It's something that we're looking into, but currently FundFinder is not available on the app stores. Since it is a web-based app, you can actually access it via your internet browser. So, for example, Google Chrome or Safari on your phone. So, with that said, you can still access it if you just go to fundfinder.org.
Yeah, that's really important. I have done that on my phone, and I encourage the audience to check this out, because it's actually really pretty mobile friendly. So check that out and just get to your browser on your phone if that's where you're able to see it. One other question coming in, and then I'm going to let this be the last question. And this person, this audience member, is saying that they're seeing that grant funds in general are hard to get this year, and they're wondering if the PAN Foundation sees that as well, and if so, why?
That is a great question, and we do receive that from time to time. Our disease fund openings and closings do vary throughout the year, and all of it is subject to funding. When we do get funding, those funds become open to the patients and those on the wait list immediately. And with the different types of um, I think in general, from year to year, it's hard to predict when we'll be able to have funding available for disease states, but we're constantly reaching out and doing outreach to our generous donors, which can really just be anybody. An individual giving program is so strong, to see if we can help and open up some of these disease states that maybe have been closed for a long time. But that's part of also the reason why we love to hear from you because just because a disease state is closed with us at the Pan Foundation does not mean that there isn't help elsewhere. And so we'd be happy to connect you with resources that we can. Fund Finder again is a great place to check if other of the 8 other foundations have your disease state covered. But as always, please reach out to us and we can see how we can help you find assistance for your disease.
Fantastic. Thank you so much, Joan, for that thorough answer. And it also highlights why it's important to regularly check back in with the PAN Foundation because if there isn't money for a particular grant now, there may be one in the future. If your medication wasn't on a list previously, it may be on the future. It may be on it in the future. And I will mirror what Joan said as well for Needy Meds, which is that if you're not finding cost savings assistance on needymeds.org or through calling one of our counselors, we will do our best to connect you with another organization that can meet that need for you, your loved ones, your patients, or clients. So, with that, I'm going to go ahead and wrap up today's presentation. We'll follow up with you via email if we didn't answer your question, but please reach out to the PAN Foundation or Needy Meds at the contact information on your screen. With that, of course, a big thank you to my friend and colleague Joan for taking time out of her day to share how the PAN Foundation can help those living with rare diseases get financial assistance. And thank you so much to our audience for joining us and participating today. We do hope you sign up for future Needy Meds webinars. Again, you can find those on the calendar of events on the bottom right hand of our homepage. And I'm happy to let you know if you check out our calendar events, you will see PAN Foundation webinars coming up in the future, and we are about to add more, so continue to check back. Thanks so much, everyone, and have a wonderful rest of the day. Take care.
Thank you, Carla, and thank you, Needy Meds. And have a great day, everyone. Thank you for joining.